So please join me in welcoming our esteemed speaker, Ms. Shravani Palnitkar, who will be presenting an insightful talk on the non-motor symptoms of Parkinson's disease and their impact on mental health. It will cover topics such as anxiety, sleep disturbances, behavioral problems, cognitive decline, supportive interventions for both patients and caregivers. Hello and welcome back, Ms. Shravani. I'm sorry. I'm sorry for the interruption. Your voice was breaking in between.
Just a second.
Okay, that's fine. Please take your time. It might be some internet issues or the connectivity problems as well. So please take your time. Till then, I would like to announce it again that if you would like to ask the questions from our respected speaker, you can raise your hand or write down the question in the comment section for all the attendees in the LinkedIn Live or in the chat box. That is for the attendees in the meeting room right now. And if the attendees from LinkedIn Live would like to join the meeting room right now, they can use the provided link or they can ask for the link of meeting room. As the registrations are absolutely free, you just have to register yourself and you'll be having a link to join the meeting room at your registered email and you can join the meeting room right away. I assume there was some connectivity problem from Ms. Shravani's side. Please provide us a few minutes till she's coming back and joining us again. Till then, a repeated request to all the attendees from LinkedIn Live to kindly introduce themselves so that we can know about you. This is July 6th, and the event is all about Parkinson's disease. We have lined up two esteemed speakers for today. Also, let me announce about the certificates till then, as many of you asked me in between. So the certificates will be provided to all the attendees who will be joining the meeting from meeting room right now. And they just have to be in the meeting room for at least 70% of the duration of the meeting. Also, you'll be asked to share the particular details at the end, which I'll be asking you, and you just have to send me the details at the end of the meeting, which those details will be used to prepare the certificates for one and all. All right, we are having Ms. Shravani back in the meeting room.
Am I audible now?
Yeah, perfectly.
Okay, perfect. Please feel free to interrupt me if I'm in case not audible at all.
Definitely. Thank you so much.
Thank you. So should we start?
Yeah, definitely you can start with.
So can you all see my screen?
Yes.
All right, perfect. Okay. So first of all, I'd like to introduce myself. I am Shravani and I'm a psychologist. I have recently completed MSc in clinical psychology from MIT Workplace University, Pune. First of all, thank you, OLCIS, for having me once again. Last time I was here, I talked about neurodevelopmental disorders. And this time, the topic interests me the most because I've recently interned under the guidance of a neurologist. So I got the experience of actually witnessing people with Parkinson's and witnessing the first-hand symptoms of them. So I think in my capacity, I would like to impart my knowledge about the disease, what core Parkinson's looks like. Also, since I am a student who is from humanities and then to science, I'm not totally from a medical field, but I'll try to touch upon the most scientific and empirical parts of it. So, excuse me if you feel anywhere that I'm lacking and feel free to correct me or whatever. So, let's delve into the presentation. My topic for presentation is understanding the non motor symptoms of Parkinson's disease and its impact on mental health. So, let's first understand what exactly Parkinson's is. Now, when you go around and in your society, you just ask a layman person as to what exactly Parkinson's is. He'll probably reply as to something that has to do with tremor, something that has to do with your movement, and basically dysregulation of movement. So, although it is correct, we have a more holistic definition of what exactly Parkinson's entails. So, to begin with, it is a progressive neurodegenerative disorder that arises due to the loss of dopamine neurotransmitter and its production and formation of Levy bodies. Now, I will simplify this definition for you. So, what exactly neurodegenerative means is basically it entails loss of neurons over a period of time, and it is progressive, which means that the symptoms keep on worsening over a period of time, right? It is, and to say Parkinson's per se, it is an incurable disease. So, what do we have at hand is to treat Parkinson's via its symptoms. So, symptom management is something that we have in our hand. All right. So, almost 80% dopamine loss occurs in the part of our brain which is called as substantia nigra. And I will be focusing on how this dopamine loss occurs in the later part of the presentation. Okay. So, how do we actually recognize Parkinson's disease? So it has four cardinal symptoms, which sets it apart or gets it easy to classify. So first, it is recognized via tremors, right? So tremors are involuntary rhythmic movement that can usually start at one part of your body, maybe hands, maybe your feet, and it can also gradually go around to your other body parts. So a person can even get tremors in their chin, their mouth, their tongue, right? Tremors are again of various types. So first thing, there are resting tremors. So suppose I'm sitting just with my hands folded and my body is at rest. Still, I can get tremors, and those are called as resting tremors. Then we have action tremors. So when I am voluntarily involved in a particular action, I'm holding a cup or a mug, I'm going to pull a mug, and that time I get a tremor. That is an action tremor. All right. Sometimes what happens is there's also another neurological disorder which is known as essential tremors. Okay, so essential tremors is not a type of tremors, it's a whole other neurological disorders. But sometimes what happens is you see a tremor and you're like, okay, this is Parkinson's. However, it can still be another neurological disorder that I stated as essential tremor. Second cardinal symptom to recognize Parkinson's is bradykinesia. It is a Greek name which states slowness in movement or rapid and it is progressive of the disease wherein the individuals can have very small handwriting, right? The size of the handwriting might be very small, which is known as micrographia. And also, there's something known as I don't remember the exact medical name, but they have a masked or flat face like expression. So, all these little subtypes come under bradykinesia. Third, what we can identify is via rigidity. So, your muscles or your overall tone of the body can become very stiff and rigid, right? And last, there's postural instability also. Now, postural instability usually occurs over a period of time as the disease advances. So your posture, a person is not able to keep his posture upright, right? So the person might either fall backwards or forwards. Now, when the person is falling backwards, he can go it is called as retropulsive, and when he's going forward, it is known as destination gait. So the person is not able to stand erectly in an upright position. So that is where postural instability takes place. Moving on. Now, before delving further into what Parkinson's is, we need to first understand that Parkinson's disease can manifest in various ways. Okay? So, how can we identify? First is Parkinsonism. That is an umbrella term for various Parkinson related symptoms, like we saw resting tremors, bradykinesia, postural instability, and rigidity. So, all these symptoms might be present, but they are not particularly due to Parkinson's disease. They can be also related to some other neurological disorder. So, it is like an umbrella term or like a general term. Second is idiopathic Parkinson's disease, which means the word idiopathic means there's no known cause for it. So you can have Parkinson's like symptoms, but their cause for occurring are not known and usually are they are said to have the dopamine loss theory to it. Third, what we know is secondary Parkinson's. Over here, you have Parkinson's like symptoms, but the cause is known, and the cause is usually environmental. So it might be something due to head trauma, due to side effects of your medications, or due to other environmental toxins that are present that led to Parkinson's. And then Parkinson's plus syndrome is something that we know, which means there are Parkinson's symptoms, and in addition to that, various other symptoms can also take place. So Parkinson's can manifest in various forms, and these are the four main forms that I stated. Moving on, this is a picture of a neuron, a normal neuron, and a neuron affected by Parkinson's. So in the normal neuron picture, you can see that dopamine is sufficiently traveling across the synaptic cleft to bind with the receptors on the next neuron. Okay. And in the neuron below it, we can see that the dopamine neurotransmitter is very in little amount, which tells us the importance of dopamine in this particular disease. Now we'll delve a little into our neurobiology, and it's important because we need to understand how exactly dopamine loss occurs. When we say dopamine loss occurs, what exactly is going on in our brain? Okay, so to start with, we have a part of our brain called as substantia nigra. Okay, it is located at the base of your midbrain and at the top of the brainstem. Okay, so substantia nigra is divided into two parts, where it is pars compacta and its pars reticulata. Now, this pars compacta particularly produces or generates dopamine, which forms this black layer that you can see. Now, this black layer is formed because these dopamine produces something that is known as neuromelanin, right? Which gives it a black color. However, pars reticulata is made up of this gray layer that you can see below the black layer, and it consists of GABA neurons. Now, a little context to why we are studying this is that in our brain, the most important pathway is the of dopamine is the nigrostriatal pathway. Okay, so this substantia nigra has this black layer, which is of dopamine formed by substantia nigra pars compacta, which goes on to connect with basal ganglia pathway. Now, basal ganglia is just about this thing, substantia nigra. And it has two parts. It has caudate and cutum, which together forms striatum. So the layer that we saw over here of dopamine formed by substantia nigra pars compacta goes on to connect with the pathway of striatum to form what we know as nigrostriatal pathway. And this is the most important pathway of dopamine generation. And in Parkinson's disease, there's dysregulation of this pathway. So, like I said, we now know what a role substantia nigra plays and basal ganglia plays. But in basal ganglia, there's also one part which is known as nucleus accumbens area. Now, this area particularly is responsible for your behavior regulation, for your personality, how you interact with others, what are the traits you um, actually represent, all of it. So, suppose this area gets affected due to, say, dopamine loss, obviously, an individual with Parkinson's is going to have behavioral problems. And it's very common that wherever an individual is facing PD, uh, people are very quick to say or judge that that is a person that is deciding to behave in this way, but they do not have that awareness that it is the underlying neurobiology which is causing them to behave in a certain way. So this is where understanding neurobiology comes into play. Again, important to note here is that not all dopamine pathways in the brain are damaged over here. Usually, dopamine is more generally produced in your substantia nigra, your ventral tegmental area, and your hypothalamus. But as we say, nigrostriatal pathway has its certain dysregulation occurring in PD, but other dopamine pathways are somewhat spared in the disease. Now let's delve into a little bit of neurochemistry once again. So far, we have talked so much about dopamine. So we know how dopamine plays an important role in everything. But it is a common myth that not only dopamine is affected in this disease, but there are other neurotransmitters who also play a role. So acetylcholine, which was the first neurotransmitter to be discovered, is usually associated with your memory, your thinking, your cognitive functions, executive functioning, and everything. So it also has a certain kind of dysregulation, which is why there will be changes in thinking, concentration, and there will be too much production of saliva. This is a symptom which I will explain later in detail. But salivary drooling is a very important symptom or a characteristic of Parkinson's disease, which usually 40 to 60% people actually undergo through. Second is norepinephrine. Now, this neurotransmitter we know is regulates our mood for our fight and flight situations, our stress. So, it can also be dysregulated in the process, wherein our mood and sleep disturbances can take place, and mild and moderate memory problems can also take place. Serotonin, which is our happy hormone, which regulates our digestion, our mood, and sleep, can be also compromised in the process, which is why oftentimes patients with PD can also have comorbid anxiety and comorbid depression. Now, GABA and glutamate are very important neurotransmitters, and as we know, the major excitatory and inhibitory neurotransmitters in our brain, and they work in a pull and push fashion. So it has been stated that these two neurotransmitters are often lowered in the Parkinson's disease. And also, so now GABA we know is the major inhibitory transmitter. All right. So when GABA action is lowered in basal ganglia because it is adjacent to the nigrostriatal pathway, what is going to happen is that there will be low levels of GABA. Now we have something known as subthalamic nucleus. Now, due to low levels of GABA, which is actually an inhibitory neurotransmitter, the subthalamic nucleus action is going to increase, which is going to add up to your motor problems because there's nothing or no one to inhibit that action. So, which is why we now here come to know that all neurotransmitter basically function in a way and their dysregulation can cause PD, but majority dopamine plays a role. Now let's talk about a little bit statistics that are there in regards to PD. When we talk globally, we know that over the past 25 years, this disease, Parkinson's disease, estimates have increased. They have doubled. And almost about 8.5 billion individuals are living with PD. And when we talk especially of United States of America, almost 90,000 people get diagnosed with PD every year. And this estimate is set to go around till 1.2 million till 2030. So that is something that we need to take care of. Third is India, which I feel there's still a lot of work to do regarding awareness about what exactly Parkinson's is. And usually over here, we visit the doctors, especially when the disease has already progressed. So the actually the core part of early intervention doesn't take place because there's so much myth, there's so much taboo, there's so much stigma, there's so much not awareness around that usually the patient visits the neurologist or the physician when when there's a progression in the disease. So India is home to 0.58 million patients of Parkinson's disease. Now let's consider Parkinson's disease as an iceberg. So when you see an iceberg, at the surface level, you see your visual motor symptoms. You will see that there's rigidity, there's tremors, there's some walking problems, there's some movement muscle problems, etc. But nobody is talking about the non-motor symptoms of the disease. You go to a neurologist, the neurologist will prescribe you medications about a condition depending on where you are at the stage of Parkinson's. But nobody's talking about what are the non-motor symptoms that you are going to face. Now, non-motor symptoms might manifest very differently for each individual based on your genetic predisposition, based on your environmental factors, and based on the progression of the disease. So we are here to know what exactly these non-motor symptoms are and how if motor symptoms are important to look at, even non-motor symptoms are equally important to address because we are going to see the overall treatment and overall health of the individual. So now, so far, we have talked about motor symptoms, we talked about tremors, we talked about stiffness, we talked about walking and gait problems. Now, we'll see the non-motor symptoms, which are not usually seen or not usually addressed. Usually, when the patient goes home, it's them and their caregivers who usually deal with these non-motor symptoms. These symptoms are very therapeutically more challenging than motor symptoms. And oftentimes, what happens is these non-motor symptoms even start before the Parkinson's disease is diagnosed. So someone can lose actually his or her sense of smell years or a decade almost before he's diagnosed with Parkinson's. What mistake happens usually is that we consider few things as a normal part of aging. So loss of smell or rigidity in muscles or something like that, or walking problems are considered a very age-related problems, which is why this problem actually this disease progression happens and you reach late at the door of the doctor. And these non-motor symptoms directly affect your quality of life. Usually, the medication that are administered to these individuals are based or are given with the aim of treating the motor symptoms, but non-motor symptoms are usually not covered in. So, what are these classic pre-motor symptoms? First, we see reduced smell or hyposmia, which is known. And if you lose completely your sense of smell, it is known as anosmia. And over here, what happens is that in the process of neurodegeneration, even your olfactory systems can get compromised, which leads to reduced smell. Now, as an experience, smell is a basic sense that we need. Now, if it is going to get compromised, you're obviously still going to have problems. Even if a person is given food and they cannot smell the food, it's going to hamper their overall experience of having appetite. So this smell is compromised. Second is constipation. So gastrointestinal tract can get compromised in the process of developing Parkinson's, and almost 70% to 80% people with PD complain of constipation. Now, what is that? We do not have to wait for disease to progress. A person can take laxatives in small amounts in order to treat constipation, right? Mood and sleep problems I'll be covering in a later part of the presentation. Fourth, what we have is fatigue. Now, what happens with this disease is that there's a lot of physical and mental exhaustion. Physically, the person has tremors, uh, and there's so many involuntary movement that physically the person becomes tired. And thinking about the disease and the preoccupation with the disease of what is going to happen, how it's going to progress, the person is going to have mental exhaustion, which leads to overall fatigue. Then we have the problem of weight loss. There might be decreased appetite in Parkinson's patients, not only because of their motor symptoms, but also because they might also experience depressive symptoms, which actually which lead them to not have a particular appetite, like a proper appetite that they could have. Um, Apart from that, there's lack of arm swinging while walking. Usually, when we walk, we have our normal arm swinging, but when you witness actually patients with PD, you'll see that they have reduced swinging in one of their arms, which can actually cause a result in both of their arms. And then, apart from that, they have shuffling gait or fascinating it. Like I said, now, especially when I was in the clinic and patients with Parkinson's used to come, they used to take very small steps and used to rub their steps as if like rubbing their shoes off the floor, which is known as shuffling pattern, right? So they had shuffling gait. Fascinating gait is when the person actually involuntarily moves a little bit forward, right? So if you touch the person or if you try to move that person even a little bit, the chances of falling are very high, right? Because they do not have that particular stability that we normally have. Focusing on neuropsychiatric symptoms, anxiety and depression are the most prevalent comorbid factors in Parkinson's disease. Almost up to 60% of people with Parkinson's have anxiety. It is not only because of their say neurochemical problems. It is not only because their serotonin systems are getting affected or norepinephrine systems are getting affected. Of course, they are a reason, but also because there's so much anxiety about what is to happen to them. They know, first of all, whenever they are diagnosed with PD, there's a psychoeducation that happens where the neurologist tells them about them and their caregivers about what the disease entails and what the disease actually is going to look like few years down the lane. So, which causes a lot of anxiety. The disease being incurable is going to, of course, cause a lot of anxiety-like symptoms. Sometimes even generalized anxiety disorder is very a common comorbid factor because this anxiety about their disease actually starts to generalize to their other areas of life. The mental health in general starts to get affected because of it. Second is depression. Almost 20 to 30% of people with Parkinson's experience depression. And these depressive symptoms often lead to apathy and anhedonia, which is the lack of interest and stopping of activities that the person previously liked. Apart from that, psychosis is also an important factor. Now, psychosis can actually take place even before PD or as a side effect of the medicines that are administered in the process. How come? Because whenever a person is experiencing Parkinson's, he'll be given L-dopa medicines, which is basically agonists of dopamine, which are going to increase your dopamine levels. Sometimes these increasing dopamine levels are going to okay, going to cause hallucinations or delusions. 40% people face visual hallucinations, while others can also face auditory hallucination. And delusions can be of various contents of grandiosity, of reference, of guilt, of persecution. Now, moving on towards sleep disturbances. Almost about 60 to 98% of patients with PD experience sleep disturbances. It can be related to difficulty falling asleep, maintaining their sleep. Even after getting up, there's no refreshment that is to be experienced. This can manifest in either REM sleep behavior disorder. REM is rapid eye movement, okay, where it is a stage of sleep wherein the individuals vividly see their dreams. So, in REM sleep behavior disorder, actually, an individual in a motor like fashion can actually act out their dreams, right? So, a person, for example, sleeping next to the person can actually face some thrashing or some lashing out because they act out their dreams. Second is excessive daytime sleepiness. Now, something known as origin system gets compromised in PD. So, a person can actually be very sleepy throughout the day. They can actually get involved in cat naps during the day. But this is very harmful because if a person is driving, it's very, very harmful. And secondly, if it's their sleepiness is constant during the day, is going to hamper their work and hence the quality of life that they wish to have. Thirdly, there's insomnia, like I stated, difficulty falling asleep, maintaining sleep, and no refreshment even after waking up. Then autonomic nervous system. Now, autonomic nervous system is the nervous system which is responsible for all your autonomic actions, so your heart rate, your breathing, everything, your salivation, everything. Now, this system is said to be dysregulated or compromised during the process. First is salivary drooling. Like I said before, there's a lot of salivary related problems that is occurring. Now, this is not due to the fact that there's excessive saliva that is produced. It's not that case, but there's a reduction in swallowing frequency. That is the problem. Production is not the problem, but how you regulate or reduce the saliva, that is compromised. So normally on an average, an individual produces almost about 1 to 1.5 liters of saliva every day. But there, in case of feeding, this action is compromised. Now, what happens is usually when this too low, the salivation can actually droop down and cause a mess, and overall it hampers their quality of life. And especially if it happens at night, it's going to disturb their sleep. Secondly, something known as seborrhea and seborrheic dermatitis is also common. It is actually the accumulation of some red patches, some irritating patches, or sore patches on your skin or on your hair, causing even scaly and dandruff. And it's usually due to the excessive sebum production. So, a patient actually visited a dermatologist and he thought he was not aware of his Parkinson's related symptoms. He thought that it was only his skin related, some rash or problem. But seeing his other symptoms of, say, gait related problems, his dermatologist actually came to know that it was like a precursor or like an underlying, say, a factor which indicates Parkinson's. Then, other autonomic actions such as sweating and bladder are also common, especially if Parkinson's disease remains untreated. There will be excessive sweating also. Bladder dysfunction in a way that the individuals has urinary frequency, hesitation, and urgency. Frequency where the person feels like peeing quite a lot of times, even when there's no actual need. Urgency where the individual feels that they have to go to the washroom, and this can be a little tricky and challenging, especially if they're in the outside setting. Hesitation in a way where there's a difficulty in starting or like initiating urination. Even sexual dysfunction is common because oftentimes the medication has such side effects that their libido levels actually reduce down. Then their sensory system. Now, sensory system is the most important system, and it is said that the sensory system gets affected first. So your smell, your taste, your and your pain-related symptoms can arise. Smell, as I said, there's loss of smell. Taste also gets compromised, and pain in a way that 50% of individuals feel pain. So it might be actually related to motor-related pain, or it can be musculoskeletal pain. Now, there are also cognitive problems associated with Parkinson's. Now, when we are saying cognitive problems, there's a research which actually states that 95% of the time, there's some thinking changes that takes place in PD, right? Now, this thinking and cognition can be related to your working memory, your executive functioning, your having clarity overall about life, your organization. So the individual might actually say that I want to carry out this function, but somehow I'm not able to because there's so much cloudiness, there's so much blurry thinking patterns as to it, right? Sometimes people do not have the capability to keep their train of thoughts. They are not able to retrieve their words. right? Apart from that, 25 to 30% of the people actually develop dementia in the course. They might even develop dementia before, but even during the course, they can develop. And now, when I say dementia, I want to burst this myth particularly that it does not mean that they experience Alzheimer's. Dementia is is a general and umbrella term, and Alzheimer's is one part of it. But with the way we are talking about the memory loss, it's different when we are saying it's PD and dementia, and when it is Alzheimer's. Because if you are telling a person with Parkinson's about a subject, you'll basically remind them about something, they are going to remember it. They are not going. It is not going to get lost from their mind, or they are not going to forget their identity or their loved ones. So this is how dementia manifestation is different in Parkinson's disease. So they're going to have problems with their executive dysfunction and their language to a point, but there's going to be impairments in their social, occupational, academic, not academic at that age, of course, social or occupational functioning. So that is when we say that it is affecting their lives. Now, like I stated before, that in basal ganglia, there's a part which is known as nucleus accumbens, which is responsible for your behavioral regulation. Now, if that is getting compromised, you're going to have impulse control problems. That, and secondly, even the medications that are administered, they are going to have their side effects in which people can actually become very impulsive and take very risky actions, right? So they can actually get involved in gambling patterns, gambling behaviors. They can get involved in binge eating patterns, excessive shopping, or sexual activities. So that is something to look out for. And oftentimes, addressing this becomes very important because worsening of impulse control problems actually creates a barrier between the individual experiencing Parkinson's and their caregivers. They're going to have arguments, they're going to have constant fights between them. And that is not the person with Parkinson's actually who that person is, but it's the disease that is making them behave that like in a certain way. That is to be understood. So it is said that about 1 in 6 people treated with this medication, like the Parkinson's related medication, will develop impulsive and addictive behaviors. Oftentimes, what happens is whenever even L-DOPA is administered, people can get addicted to the medication because it activates the reward centers in the brain. Also, about 40 to 90% of people are prone to falls. This is also because of their postural instability and overall motor problems. So, what we can do if we have someone who's experiencing Parkinson is to make sure our home is safe. We do not have those kind of pointy and sharpy furniture, which can be harmful for them. Secondly, appropriate footwear. They can use rubber soles or a footwear that can actually ensure that they do not have walking related problems. They can take bigger steps while walking in order to maintain stability. And then using a walker or a cane is always an option. Okay, so health seeking behavior, what's that? I've deliberately put this question because in 2007 there was a study done which stated that almost 58% of people with Parkinson's were depressed, 45% people were anxious, and 63% had problems with concentration, yet only 11% of people saw a mental health professional because uh, that it is considered the non-motor symptoms and mental health related conditions are considered so part and parcel of the disease that nobody actually cares about visiting a mental health professional. And this is very important because if you want to holistically treat a patient or get treated, you have to focus on both your physical and your mental aspects. So if you're going to be right and make peace with things over here, it is obviously going to reflect in your motor symptoms. And if not improve, at least they will not worsen that quickly. So, which is why having a good mental health in place is important. Now, what happens in the scenario at home is that oftentimes the caregivers are bound to sit next to the patient because they have a patient at home, which is why caregivers often start to experience depression related symptoms, anxiety related symptoms, or other psychological and mental health problems because of their coping abilities are constantly tested. Dealing or being in surrounding of a patient is not an easy task. So their sleep can get affected, their coping skills are going down, then they are obviously experiencing financial burden because of the expense that goes on when you have a person with a certain kind of a disease or disorder at home. And obviously, there's a lot of exhaustion of emotions. So, what happens is oftentimes there's a barrier created between the person experiencing Parkinson's and their caregivers. So, what can be done in case of caregivers? In their interviewing must be done by physicians. Physician must take into account that even caregivers have a life beyond just being there for their family members experiencing that particular disease. They should be also undergone like through assessment so that we have a check if the caregiver is all right, if they are not experiencing particular anxiety or depressive like symptoms. So we can administer assessments on them to ensure that their mental health is in place. Then apart from that, you can always encourage them to hire some aides on an hourly basis to sit next to the or take care of the person and to make sure that they are taking time for themselves because a disease can take toll on the mental health of the individual experiencing it as well as on the caregiver. And our goal through this is to reduce the intensity of the symptoms of the disease and works towards the greater goal of improving the quality of life, which I consider is the ultimate goal uh, of us being in the healthcare profession. So that's my time. Thank you so much.
That was a great talk presentation from Ms. Shravani Palatkar. Thank you for enlightening presentation on the non-motor symptoms of Parkinson's disease. And it really covered topics such as neurobiological basis, pharmacological challenges, caregiver impact, and holistic care approaches.
Thank you so much.
Yeah. So we were having a few questions for you. If you can read them from the chat box, or should I read them out for you?
Sure. Okay, wait.
Definitely.
Okay. How to recognize non-motor symptoms? All right. So over here, a lot of things come into play. First of all, if you have a person in your family who is at the age of developing a particular neurodegenerative disease, say at 60, and the particular person is complaining of problems, suppose say of constipation or of say loss of smell or other related problems, which usually can be considered as an older, a part of normal aging, as older aging, we can actually get them tested in order to at least know that we take a preventive approach, right? So oftentimes when you go to a physician or a neurologist and you tell them what exactly other symptoms that you're experiencing in your normal life, they can also understand that it might be indicative of Parkinson's disease.
Great. Thank you so
Second,
much for taking the question. Yeah, we are having a few more.
yeah, I am taking my time to read. What recent discoveries
Please
have
go.
been made regarding autonomic nervous system dysfunction in Parkinson's disease? All right. So, autonomic nervous system dysfunction. So, particularly, in my knowledge, when there's salivary drooling, there's a lot of new treatments as to salivation Botox. So Botox that is usually used to for your face, for your wrinkles or whatever that offer, it can actually be administered in saliva because some people can actually experience a lot of salivary drooling. So that can be done. If you are experiencing excessive salivary drooling, you can chew on some sugary foods, some gums, some strips that can actually keep basically new discoveries in autonomic dysfunctions always date back to your traditional methods. So having perfect diet, having lot of fluids are going to help you to regulate at least in some point your autonomic nervous system. What role does interdisciplinary research play in developing new interventions for Parkinson's disease, and can we provide any recent examples? All right. So now, taking an interdisciplinary research, or like even if you say multidisciplinary, I am a psychologist. I am not very well versed with the neurology part of diseases, but still, I know that when I was interning, there were patients who did not just wanted to get a prescription of their neurological disease. They want to talk about their problems. They want to know how their disease is going to progress, what level or the stage they are in. They want a realistic understanding. So over here, the talk therapy or applying CBT principles. Over here, the role of psychologists can come into play. Obviously, pharmacologists, they have their role when it comes to, especially say, creating medicines in order to weigh. Like for example, I'll give you an example. You know how L-DOPA, when it is administered, sometimes what happens is there's excessive dopamine produced, right? So it sometimes leads to psychotic symptoms. So over here, the uh, therapy, like pharmacologists and those professionals have a role, challenging role to play in order to create and curate a medicine in a way which addresses all these side effects. Because each medications has, in Parkinson's especially, has particular side effects which tends to sort of worsen and causes a challenge to them. So that's where I think a multidisciplinary approach comes into play. What innovative methods are currently being researched or used to detect early cognitive decline in Parkinson's patients? All right. So innovative methods of, I think in my knowledge, what is done these days is there's known as DAT scans, which is dopamine transporter scans. So what these scans usually do is that they check the dopamine levels at your presynaptic neuron. So they actually see the functioning of how dopamine is reducing at today's rate, and they can also predict how 5 years down the lane or 10 years down the lane can dopamine loss occur. How will we get to know? Okay. Okay, how will we get to know the non-symptoms if the age of person is approximately 30, 40, 50? Then how will we recognize it? Okay. So usually this is a very challenging task because this usually Parkinson's doesn't occur very early, but when it does, it is known as early onset Parkinson's disease. Now, when these symptoms occur, the it depends on what symptoms basically first take place. If it's loss of smell, nobody's going to first of all think about that. Oh my God, it's going to be Parkinson's. It might be probably due to COVID also. Like if you talked about it 2 years back, so what is actually, what are the accompanying symptoms along with that particular symptom, right? So in that case, if you have two or more symptoms, which is not exactly 100% indicating towards Parkinson's, usually on them scans are done, PET scans can be done, or any other related dopamine specific also scans can be done in order to assess if there is uh, um, probability or a possibility of developing Parkinson's. Apart from enhancing good quality lifestyle, what are the other approaches should we take? Okay, so I think nutrition plays an excellent role in this. Having proper diet, having proper okay. Your question is what are the other, okay? Having proper diet, having proper fluid intake is going to help. Also, Parkinson's disease, like for your question specifically, it does not have a specific biomarker, right? If there is going to be aggregates of something that is known as alpha synuclein, in Parkinson's disease, there's aggregation or development of a protein called as alpha synuclein. So these things are not very predictable. So on our end, our responsibility is awareness of the disease, taking the best care in our lifestyle. But what goes on inside our mind or our brain is not something that is in our hands. So that's about it.
That's great. I appreciate all the questions from all the attendees. And thank you so much for taking up the questions, Ms. Shravani. There's
And
one more question.
yeah. So there's nothing called as best cure because for every individual, it can for some individuals, taking L-Dopa can work the best. But for some individuals, L-Dopa might not work, to which they can actually require deep brain stimulation, right? So sometimes even DBS is administered to them to relieve them of symptoms. So DBS can also work.
Great. Thank you for the questions to Mr. Ashutosh. And we will keep on asking more questions and discussing more points with Ms. Shravani, as this is the time for our next talk presentation. Yeah. Thank you so much to Ms. Shravani. Please stay connected. We might be having more questions and more points to be discussed with you.
Thank you so much, and thanks for asking such insightful questions.
That's all credit goes to our attendees. Yeah, with your permission, let's move to our next speaker, Dr. Sampurnam Webster, and her two students. All right, please join me in welcoming our esteemed speaker, one of our OCM also, Dr. Sampurnam Webster, who will be presenting a talk on artificial intelligence and Parkinson's disease. Hello, Dr. Sampurnam. I hope I'm audible to you. Also, the two students, please let me know if you're here. Amrita and Aswati. Are you present here in the meeting room right now?
Yes,
Yes,
ma'am.
the voice is echoing, dear. If you are using two instruments, please use only one. It might be the reason. Okay. Hello, Dr. Sampurna. There might be some internet connectivity issues. So let us give a few minutes to Dr. Sampurnam to join us again. Till then, let me welcome to a few more researchers or few more attendees from LinkedIn Live. Yeah. Hello. Yes, doctor.
Can you hear me?
Yes, doctor.
Can you hear me now?
Definitely.
Yeah, thank you.
Yeah,
So actually,
welcome back.
Ghazal, I'm fine, great. How are you?
I'm good too. Thank you.
Okay. First, Shibu will be talking about the artificial intelligence and Parkinson's. So followed by her, Amrita will be just giving lecture, and finally I'll touch the points, scientific points.
Definitely,
That's
doctor.
a speaker lineup, Ghazal.
Okay, definitely.
Thank you.
So here the next session starts from Ms. Shibu.
Yes, ma'am.
Yeah.
Shall I start, sir?
Yeah, definitely. With your introduction, and then you can start with the presentation.
Yes, ma'am. Good evening to all. I am Ashwati Shibu. Today I am going to present about the topic on artificial intelligence and Parkinson's diseases. Next slide, please. Let's delve into the world of artificial intelligence and Parkinson's diseases. Definition. Parkinson's disease is a progressive neurodegenerative disorder that primarily affects movement. It results from the loss of dopamine producing neurons in a region of the brain called the substantia nigra. Next slide. Symptoms. The symptoms of Parkinson's disease can vary from person to person, but they generally include: first one, motor symptoms. Tremor, often starting in a hand or finger. It can be more noticeable at rest. Bradykinesia, slowness of movement, making simple tasks time consuming. Rigidity, muscle stiffness that can occur in any part of the body. Postural instability, impaired balance and coordination, leading to a tendency to fall. Next slide. Second one, non-motor symptoms. Cognitive impairment, including memory difficulties and slow thinking. Mood disorders, such as depression and anxiety. Sleep disorders, including insomnia and REM sleep behavior disorder. Autonomic dysfunction, such as constipation, bladder problems, and blood pressure fluctuations. Next slide. Causes. The exact causes of Parkinson's disease is unknown, but it is believed to involve a combination of genetic and environmental factors. Genetics. Several genes have been linked to the disease, but only a small percentage of cases are directly inherited. Environmental triggers. Exposure to certain toxins, such as pesticides and herbicides, has been associated with an increased risk. Next slide. Early identifications of Parkinson's disease using AI. First one, medical imaging analysis, MRI and PET scans. AI algorithms analyze brain imaging to detect early symptoms of Parkinson's diseases that may be invisible to the human eye. These algorithms can identify patterns and anomalies in brain structures and functions associated with the diseases. Next slide. Second one, voice analysis. Change in voice such as softer, monotone, or tremulous speeches can be early indicators of Parkinson's disease. AI system of analyze voice recording to detect their subtle changes and predict the likelihood of the disease. Third one, gait and movement analysis. Wearable devices and smartphone sensors can track a person's movement and gait. AI models always analyze this data to detect early motor symptoms of Parkinson's disease, such as tremors. Next slide. Measuring severities of Parkinson's disease. The severities of Parkinson's disease is typically measured using several standardized scales and assessments. Some of the most commonly used methods include: first one, Unified Parkinson's Disease Rating Scale. This comprehensive tool evaluates various aspects of the diseases, including motor symptoms, daily living activities, and complications, is divided into four: mentation, behavior, and more. Activities of daily living, motor examinations, motor complications. Next slide. Second one, Schwann and England Activities of Daily Living Scale. This scale measures a patient's ability to perform daily activities independently, expressed as a percentage from 0% to 100%. Third one, Non-Motor Symptom Scale, NMSS. This scale assesses the non-motor symptoms of Parkinson's disease, such as sleep disturbance, mood disorders, and gastrointestinal issues. These scales help healthcare professionals to evaluate the progression of the disease and to tailor treatment plans accordingly. Thank you. Over to Amarda.
Diagnosis. There is no definitive test for Parkinson's disease. Diagnosis is primarily based on medical history, symptoms, and neurological and physical examination. Imaging tests such as MRI or DAT can support the diagnosis by ruling out other conditions. Next slide. Autonomic diagnosis for Parkinson's disease using artificial intelligence. Autonomic diagnosis for Parkinson's disease using artificial intelligence involves leveraging machine learning and others. AI technique to detect and diagnose Parkinson's disease autonomously. This approach typically includes the following components. Next slide. First one, data collection. Data is collected from various sources such as medical records, wearable devices, voice recordings, and imaging studies. This data includes motor symptoms and non-motor symptoms. Second one, feature extraction. Relevant features are extracted from the collected data. For example, from voice recording, features such as pitch, tone, and speech rate can be extracted. Next slide. Third one, machine learning models. AI models, particularly machine learning and deep learning algorithms, are trained on the extracted features. Commonly used models include decision trees, support vector machines, neural networks, and convolution neural networks. These models learn to identify patterns and correlation associated with the Parkinson's disease. Fourth one, training and validation. The AI models are trained using labeled data set where the presence or absence of Parkinson's disease is known. The models are then validated using a separate data set to ensure accuracy and reliability. Techniques such as cross validation are used to improve the generalizability of the models. Next slide. Fifth one, autonomic diagnosis. Once trained, the AI system can autonomously analyze new patient data and provide a diagnosis. This involves processing the data through the trained model to predict the likelihood of Parkinson's disease. Sixth one, continuous learning and improvement. AI system can be continuously improved by incorporating new data, refining algorithms, and updating models. This helps in maintaining accuracy and adapting to new findings in Parkinson's disease research. Next slide. Examples of AI in Parkinson's disease diagnosis. Wearable devices. Devices like smartwatches can monitor symptoms such as tremor and gait disturbance, providing continuous data that AI can analyze to detect early signs of Parkinson's disease. Voice analysis. AI can analyze speech patterns to detect subtle changes in voice that are indicative of Parkinson's disease. This is based on the observation that Parkinson's disease affects the vocal cords and speech production. Imaging analysis. AI algorithms can analyze brain imaging data to detect structural and functional changes in the brain associated with the Parkinson's disease. Thank you. Over to Dr. Sambhurna.
Yeah, let me please confirm if we are having Dr. Samburnam in the meeting room right now.
Can you hear me, Hazel? Yeah.
Yes, yes, doctor. You can continue. Thank you.
Thank you, Amrita. I'm just continuing with direction of artificial intelligence. Artificial intelligence is a broad and multifaceted field that involves the creation of systems capable of performing tasks that typically requires human intelligence. You all know that artificial intelligence is peak at present. So it is no wonder that it is again going to help out in ruling out all Parkinson disease, of course, treating and even diagnosing Parkinson disease. So actually speaking, more than artificial intelligence, human intelligence are really hiking. And only because of human intelligence, we can make out artificial intelligence. The detection of artificial intelligence encompasses actually, there are certain principles which encompasses the detection of AI. Next slide, please. Yeah, principles. Number one is machine learning. You all know about machine learning. So it's an ability of system to learn from data and improve over time without being explicitly programmed. It is the programming, you all know that. And based on machine learning, they create many more drugs. So it just talks about the potency, frequency, duration, or even whatever it may be related to drugs. It decides and it designs drug. And even the target population who is going to receive that particular drug is also decided by machine learning. So we are living in high scientific, high-tech, high-touch approach world. Next could be like neural networks, a series of algorithms that attempt to recognize underlying relationship in a set of data through a process that mimics the way the human brain operates. So it's no wonder that just like how a human brain can operate, exactly the AI algorithms can also operate. So here you should know about algorithms. So AI algorithms or backbone, actually speaking, and it enables missions to stimulate human like intelligence, actually speaking. Next slide. Yeah. Next is natural language processing. It can be just put an abbreviation called NLP. The ability of machines to understand and respond to text and voice data in a way that is both meaningful and useful. Next is robotics. Robotics, you all know it's for a long time. Thus, and the design and construction and operation of robotics that can perform tasks automatically or semi-automatically. So recently I read an article. I just want to share with all my students and of course all the attendees in this event. So in South Korea, they have designed a robo, and that robo was working in a company, private company. It's no wonder it committed suicide one fine day because of workload. Just imagine, it is working day and night throughout. So after a long, tough time and tedious work, it felt that I should not work hereafter, and it committed suicide. So it's the first robotic suicide in this world. So even a robo is committing suicide because of tedious and hard work, and of course, like work, what can be simply called as work stress, etc., etc. So just imagine how far the human being will work with all stress. Okay, next slide, please. Yeah. AI blood test could detect Parkinson disease. The test could detect Parkinson disease up to 7 years before symptom. See, before the symptom could appear, before 7 years itself, AI, artificial intelligence, could detect Parkinson disease through blood test. So Parkinson disease is a common neurodegenerative disorder. We all know that. The AI-driven test is less invasive than traditional Parkinson's diagnostic test. We all know about traditional Parkinson. It can be like invasive blood test or like MRI, SPECT, or even simple computed tomography or any other. But at present, AI is, it's really speaking, it is not, it is very, and it is less invasive also comparatively to traditional Parkinson's diagnostic test. So researchers have developed a new blood test that can predict Parkinson's disease up to 7 years before symptom appears. And this is a progressive development movement disorder that causes symptoms such as tremors, speech changes. You all know that. And of course, previous session that Madam, she explained well about all these symptoms and non-motoric symptoms. And researchers from University College London and University Medical Center in Germany, they developed new AI-powered blood test to detect Parkinson's disease. Next slide, please. Yeah, plasma proteomics identified biomarkers. So at present, we have biomarkers for just for predicting Parkinson's disease up to 7 years before the symptom onset or the onset of symptom. So this Parkinson's disease is increasingly prevalent, and it progress from pre-motor stage, as that ma'am told previously in previous session talk. Like the pre-motor symptoms, to my knowledge, in clinics, I've been with Parkinson patients for 15 years. I've handled them in clinics. I was a psychiatric nurse for 15 years, and I have handled many Parkinson patients. That too, I've handled only drug-induced Parkinson because of antipsychotics. So all the premotor symptoms I have observed is like constipation. Very frequently, I have observed constipation, and loss of smell I have observed, to my knowledge, in 15 years of clinic experience. And of course, sleep disturbance, commonly they'll report. And next is mood disturbance, especially like depression I have observed. So all these could be like premotor stage or symptom. And it is really disabling motor stage. Machine learning model accurately identified all the Parkinson patients and classifies 79% of the premotor individuals up to 7 years before motor onset by analyzing the expression of 8 protein granulin precursor. So our body structure is protein, our brain is also protein, memory is also protein. So many of these biomarkers, it correlates with symptom severity because of this 8th protein granulin precursor, and it indicates a molecular event in early stage itself, like premotor stage, as I told, like constipation, loss of smell, sleep disturbance, mood disturbance, like depression, whatever it may be. In such stage itself, this precursor we can just identify in blood, especially through biomarkers. The two artificial biomarkers really they help us out in detecting all these before 7 years. Next slide. Yeah. Next is like treatment. While there is no cure for Parkinson's disease, several treatment can help manage symptoms like medications. You all know levodopa. Some most effective treatment, it can be converted to dopamine in the brain, and dopamine agonist mimics dopamine effect in the brain. And MAO, monoamine oxidase B type inhibitors, it helps to prevent the breakdown of brain and dopamine. And COMT inhibitor prolong the effect of levodopa by blocking its breakdown. So all these drugs are available, but still there is no complete cure. Next slide, please. Yeah. So there's a surgical option. So like deep brain stimulation, it can be just put as DBS. So it's nothing, it's a very simple surgical procedure or implantation of neurostimulator or electrodes into the brain. So they just implant electrodes in the brain to reduce the Parkinson symptoms. So at present, it is highly recommended in clinics. Next is lifestyle supportive therapies like physical therapy to improve mobility and flexibility. Of course, it improves the blood circulation and it keeps a person fit. Occupational therapy to help with daily activities, and occupational therapy therapist will visit and they'll give all activities to make them live independently. And speech therapy to address special speech and allowing their difficulties. In such case, at present, they recommend robotic speech therapy. See, robots will be just placed inside in front of the client, like Parkinson client, and this robot will have eye contact, will make them to talk in their own language. They can set language. If they suppose they are comfortable with English, it will be put an English word, English language. They're comfortable with any other languages, it can be set in that particular robot, and it will just make them to talk. The speech therapy will be given by robot itself. And exercise, regular physical exercise can improve overall well-being and motor function because of blood circulation, of course, endorphin release in the brain and blood, and sympathetic nervous system stimulation will be less, and parasympathetic will be activated so that a person with Parkinson is again fit with exercise. Next slide, please. Prognosis. So Parkinson disease prognosis slowly only with the symptoms worsening over time. Although it significantly affects quality of life, many individuals live with the same disease for many years together. Even I have witnessed in my clinics. So management focuses on elevating symptoms and maintaining independence. Next slide, please. Yeah, research. So this ongoing research is aimed at better understanding the disease, finding more effective treatment, and ultimately seeking a cure. Like current area of study include like gene therapy, stem cell therapy, and neuroprotective agents can be like nothing but dopamine agents. Like it can be like MAO, monoamine oxidase B type inhibitor. Just now we discussed about that, and a special drug called salicylic. It's nothing but a transdermal patch. It will be just put against the skin over the abdomen or the back or the chest of the person, so that it is absorbed for a long time, like 24 hours, and it will just shrivel after 24 hours. It's a very good drug which just protects against from all this, the Parkinson symptoms. And at present, one more research add-on I would like to give here is at present, Parkinson patients will have tremors, right? We all know that. And to just put down the tremors, at present, they don't give any drugs. What do? Is they just give eye waves of magnetic ultrasound waves to the brain. It is a non-invasive procedure, no more like surgery or nothing. They don't dissect nothing. So it's a non-invasive procedure. Magnetic ultrasound waves are just passed inside the brain, so that the tremors are literally reduced after few sessions of that particular treatment. So that is current treatment which they follow for tremors. Next slide, please. Yeah, final conclusion. So AI is poised to re-evaluate the diagnosis, management, and understanding of Parkinson disease by leveraging its capabilities in data analysis, pattern recognition, and predictive modeling. AI has the potential to enhance both clinical practice and research efforts, ultimately improving outcomes for individuals living with Parkinson disease. However, ongoing research, validation, and integration into clinical settings are crucial to fully realizing the benefits of AI in Parkinson disease care. So, any queries can be put in the chat box. Thanks, Gezel, for your time. Thank you so much.
Thank you so much, Dr. Sampurna, and her two students, Amrita and Aswati. Thank you so much for explaining why artificial intelligence and Parkinson's disease are interlinked. So, Doctor, before anyone else is asking any question, I'm having a question. As you mentioned about the robot from South Korea, right? So, the robot committed suicide. I thought the suicide is an outcome of pressure, depression, anxieties in human beings. So, what might be the reason for suicidal attempt or like the suicide of that robot in particular? As far as we know, robots do not feel any anxiety, stress, and depression, right?
Yes, I love to hear the same question from you, Gezel. The thing here is, something. Uh, See, robo will be designed. I'm not a robotic, what to say, engineer. First of all, you should
Mhm.
understand that. But still, I have little knowledge about robotics because I love robotics. See, robots will be designed. So with all like neural schema, complete chips, everything will be installed and it will be designed well in a well manner. So after
Okay.
designing, what they'll do, they'll go for machine learning. In At present we have machine learning through AI, but in robotics also there'll be machine learning. They all those machines will be teaching about feelings to that particular robots. I think you would have watched movie Endran. I think it's Rajinikanth's movie. It's a very practical
Okay.
movie. You can just watch it. So it will have feeling also. It can sense feeling, human brain, human thoughts, human cognition, human behavior, everything it will have. So to one stage, it was unable to cooperate. It committed suicide.
Okay. And definitely, I'm going to see that movie tonight. I mean, thank you so much for taking my
Please watch
question
it.
and
It is in
answering.
YouTube. Please watch it.
Definitely, I'm going to watch it tonight. And okay, well, we are having one more question. Should I read it out for you?
Yeah, please.
Okay, so the question is, what are the ethical considerations and potential biases that need to be addressed when implementing AI in Parkinson's disease research and treatment?
Yeah. First of all, I appreciate this question. The thing is, as per research concern, we should go for risk benefit ratio. How far the patient is benefited from this particular research or AI detection, or it can be like simple blood test or early diagnosis before 7 years, or any other, or it can be even simple machine learning treatment, whatever it may be. Before they could start, a researcher should go for risk benefit analysis. The ratio should be rather comparatively to the risk benefit ratio should be more so that they can continue with the research, and it should be well explained all the what to say, like anonymity, beneficence, non-maleficence, justice, all the ethical principles should be explained well.
Great, thank you for your answer. There's one more question. The question is, what future trends do you foresee in the use of AI for Parkinson's disease, and what areas hold the most promise for breakthroughs, according to you?
The groundbreaking research at present is purely related and the focus is on Parkinson treatment. So I promise and I believe that treatment could hike after 10 years, like after a decade. all individuals will be receiving Parkinson disease treatment only through AI.
Thank you, Doctor. So let me announce if any of our attendee wants to ask any question from any of our speaker, as this is the questionnaire session, please come up on your screens, unmute yourself and ask the questions. For those who are listening us and watching us from LinkedIn Live, they can send the question in the comment section. Till then, I forgot to welcome Dr. Sharad Babu and Murtaza Malik and Puneet Reddy Chadda. Welcome back to our event. Okay, this is the questionnaire session, everyone. If you are having any question to be asked from our speakers, please go ahead and ask your questions. Till then, I would like to take a minute to announce about our next upcoming event, which is about neurosurgery. The event will be on July 20th. One of our speaker, Dr. Ali Haider Bangash, will be here to present his talk in our next event, and a team from Dr. Hapchi Navel is coming up. Okay, according to your query, Mr. Sahil Fayaz, you watched half the event on LinkedIn and joined the Zoom for the half one. That's fine. You just have to share the details which I'm just going to ask in the meeting room to get the certificate. So this is the time I should ask for the details from our attendees so that we can prepare their certificates, and certificates will be provided to all of you within the 3 next working days on your provided email addresses. Please make sure you have registered for the event, as the event was free for everyone. The links were provided everywhere. Okay, so please share your full name along with your designation. As it is professor, doctor, you would like to have a Miss or Mr. in before your name, your email address, and your country name. Please share the following information in the chat box and in comment sections. Those are watching us from LinkedIn Live. Till then, let me announce if you are having any other question you want to ask to any of our speaker, please go ahead and ask your question. You can write your question in the chat box, come up on your screens and ask the questions by unmuting yourself, or just raise your hands. And if you are someone who will be watching the recorded version of this meeting later on, you can write down your question in the comment sections. Either it is on the YouTube or LinkedIn Live or from our website. You can write your question in the comment sections and we will definitely try to get the answer to you. And please do not forget to provide your email address with that. Thank you for those who are sharing their details here, which I have asked. Again, the next event will be on July 20th on neurosurgery. Dr. Hapchi Navel is coming up with 3 of her professionals who will be presenting talks related to different sessions, and one of our previous speaker, Dr. Ali Haider Bangash from Pakistan, is also coming up. You will soon see the sequence lined up on our website. And if you are someone who is interested in presenting talk in any of our lined up events, as we are having a series of events planned for this particular year, then please do not forget to submit your research abstract with us. We from Allshares welcome all the suggestions and questions from any of our speaker, attendee, delegate. If you would like to add any event or track or session to any of our events, please do let us know. You can write down the mail to us. The email address has been provided everywhere. Or just reach out to our website. It's just www.olcias.com. Thank you. This was Ghazal Johar. And I again thank Ms. Shravani Palnatkar for presenting a talk presentations on understanding the non-motor symptoms of Parkinson's disease, impact on mental health, and Dr. Sampurnam Webster with two of our students, Amrita and Aswati, to provide insights about artificial intelligence and Parkinson's disease. Thank you so much for your appreciations, Ms. Palnetkar. It's always great to have you. All right, this is the time when I must have to say like goodbye to all of you so that we can meet next in our next event. Take care till then. Be healthy and happy. Let's meet in our next event on neurosurgery on July 20th. Thank you and very good morning, good evening, good night to one and all. Namaste from India.